I work group 6 in our practice is intramuscular polymer drug delivery of vitamin B3 for the treatment of polycystic kidney disease. I'm Madison Crone.
I'm Emily Karen.
I'm Sydney Gustafson.
And I'm Conrad Ruiz.
So the kidneys are in charge of things such as removing waste, regulating fluids, and maintaining blood pressure, but with a disease such as polycystic kidney disease, these functions are compromised. PKD is one of the most common causes of kidney failure in the United States, and it's basically a genetically inherited disease which causes cysts to grow on the kidneys. And these cysts inhibit kidney function and end up causing, in about half of patients, renal failure, and a lot of them require dialysis or kidney transplant by the age of 60.
There is currently no known cure for PKD, and all of the existing treatments revolve around pain management, including diet regulation and medicines to manage symptoms. In severe cases, surgery to remove or shrink cyst growth is an option. These treatments lack long-term pain relief, and even after surgery, the cyst can reform. Another existing treatment is found in over-the-counter vitamin B3 supplements, which have been shown to reduce cyst growth. However, this treatment often leads to toxic amounts of vitamin B3 being introduced to the body. So what we need is a non-toxic long-term treatment able to relieve pain, reduce cyst size and growth, and delay disease progression.
So in order to achieve the full benefits of vitamin B3 but to avoid the toxic effects, we developed an implantable drug delivery system which is inspired by implantable birth control. So this is an intramuscular device which will be inserted between the external obliques and the latissimus dorsi muscles right above the third lumbar vertebrae. So this site was chosen as the delivery spot because it is close to the kidneys and it's very easily accessible during a minor surgery. So this was chosen, the implant will have a diameter of no greater than 2 millimeters so that the discomfort during surgery is minimized, and it'll be between 4 and 8 centimeters in length, which is 1.5 to 3.2 inches. So this drug delivery implant will be made from PLGA, which is a common biomaterial used for drug delivery. And it's good for drug delivery because the ratio of PLA and PGA can be altered to achieve a desired delivery profile. And we estimate that we want our system to be about 85 to 90% PLA. PLA degrades much slower than PGA, so it's ideal to have more PLA in longer-term delivery systems. So nicotinic acid is a fast-acting form of vitamin B3, and this is the form we will be delivering. So this vitamin B3 will be encapsulated in chitosan, which is a good molecule for drug delivery to the kidneys because it's uptaken readily by the renal tubular cells. So as the PLGA degrades, the chitosan will enter the bloodstream just above the kidneys. So it'll then enter the kidneys, and the renal tubular cells will take in the chitosan, and the chitosan will be broken down and release the nicotinic acid. So then the nicotinic acid will enter the tubules where they will treat the cysts right at their sites, and about 5 milligrams a day will be delivered.
So some of the benefits which Cindy just alluded to really imply that our device is going to bypass the digestive system and the liver, which is going to reduce the toxic issues that come with taking vitamin B3 supplementally. Not only that, by using nicotinic acid right directly at the source of the kidneys, we're allowing for higher drug absorption. The procedure itself will be minimally invasive, and we're essentially looking into this product for both an early and a late stage PKD usage. Early stage preventative measures to prevent the disease from forming, and late stage for helping those stay away from dialysis and kidney replacement. Some of the minor costs involved are also the surgical procedure itself, as well as the need to replace or remove the rods every 6 months due to degradation. Some of the current competitions usually involve a number of drugs which are right now being tested but are not yet FDA approved. Niacinamide is one of those drugs. It's the vitamin B3 over-the-counter supplement. On top of that, we have metformin, pioglitazone, tazobactam, and tolvaptan. All of these drugs essentially look to inhibit cell proliferation in some way, shape, or form. If not, pioglitazone in particular inhibits the chloride secretion into the cysts. Again, these drugs have not yet been FDA approved. The alternatives, despite these drugs, are still the ones we mentioned in the background. Dietary control, surgery for late stage. They're not exactly ideal. They don't really address the problem of PKD. Dialysis and kidney replacement are also the least ideal situations for those in end-stage PKD. So how are we better? We want to change the looks of PKD and make it so that you only have to look at a biannual checkup rather than a daily pill. There's less human error in having to take a pill every day. Instead, what you're doing is you're just having 2 rods inserted, or just 1 rod inserted into the back that you won't have to deal with until your doctor checks you up every 6 months. That's the end of our presentation. Do you have any questions?